Well, we've learned a lot here. Excuse me. Hey, we're almost done. Can you give us a couple more minutes?
Yeah.
Thank you. Sorry about that. I wonder if our guest educators have any other final pearls. Dr. Collins?
So it's really important to be enthusiastic about the video review process. Your resident is going to have their reservations and may not see the value to begin with. Why don't you think about doing your own videos of your visits and show them to a colleague you respect? Or perhaps show them to your resident. You'll learn something too.
Nice. Any final thoughts on formative feedback and assessment? Dr. Vandergoes?
Assessment has two domains. There is summative assessment, which tells us if we have a competent resident at the end of the program. And then more importantly, there is formative assessment, that course correction, that feedback, all those little myriad moments of feedback that you give to your resident throughout your time with them. This is what drives learning. We need to capture a lot of these moments to form a body of evidence for the resident for feedback. One of the best ways that we do this is by video recording and video review.
I couldn't have said it better. Seriously. Dr. Sedonik, do you have any other final pearls?
Feedback is a skill. It can be learned, and with practice, it can be perfected. So I usually advise people to try out their feedback skills with fairly straightforward feedback scenarios. So one of the things that you can do in these particular examples, the preceptor has the opportunity to view the video before sitting down with a resident. I encourage you to do that, because then you can target what behaviors you need to discuss with the resident. Some of them will be easy, and you'll go into that scenario confident that you can engage in that discussion in an effective manner, but some scenarios might be difficult. Practice just identifying specific behavior that they need to reinforce.
So practice, practice, practice.
Good. One more time with feeling.
So practice, practice, practice.
Great. One more time.
So practice, practice, practice.
You got it.
Thank you. Leslie, anything else?
Another pearl I'd like to leave you with is role modeling feedback. I'm asking you to engage in feedback with learners, but I'd like you to role model feedback in front of learners. So when you're with patients, after a patient encounter, in front of the learner, reflect on your own performance. This is what I think went well. This is what I would have done differently. What is your perspective? How do you think we could have diffused that patient's anger? If the learner sees that you're open to formative feedback, they'll be more open to feedback.
I like that. So you turn the tables on the learner to show them that you are also open to feedback. Do you have one last pitfall and a pearl, Leslie?
Many of us as clinical preceptors think teaching is the dissemination of knowledge in the clinical setting. Really, to be an effective clinical teacher, your focus should be on improving your learner's clinical performance. If that is the definition of an effective teacher, then feedback is teaching. Only by providing information to learners about how to improve their performance can you actually make a difference as a teacher.
That was great. Special thanks to Dr. Leslie Sedonik for her feedback on feedback. Also thanks to Dr. Chris Collins and Dr. Teresa Vandergoes for their thoughts and wisdom. I wonder how our preceptor is doing. It's been a long time since we've checked in.
You know what? Video review makes me a better preceptor.
That's fantastic. I wonder how our resident learner is doing.
Video review has changed my life. I feel like a better doctor.
Nice. It must have been all the effective feedback he received. In 3D. This concludes Pearls and Pitfalls for Preceptors. Hey, I can see a lot of things with these glasses on. Look at all the people out there. Hey, is that you, Steve? Oh, there you go. Thanks, Steve. Oh, there's Director Derek. Thanks, Director Derek. Oh, there's Leslie. Thanks, Leslie. Oh, there's Chris. Thanks, Chris. And Teresa. Thanks, Teresa. We'll see you in the sequel.